Students, we have a class of the bones of the lower limb today. So we're going to start. The bones of the lower limbs are number one, hip bone. Then there is a bone in the long bone in the thigh, which is called the femur. Then in the leg region, we have two bones which are called tibia and fibula. And then there are foot bone में tarsals, metatarsals, and then there are phalanges. Okay, we are going to start with the hip bone first. Hip bone is composed of three separate bones. One is it's a single bone which is made up of three separate bones. They meet one another at acetabulum. Acetabulum is a cavity. Just like in scapula we have glenoid cavity, here in hip bone we have the acetabular cavity, which articulates with the head of the femur to make a hip joint. Now we see in the hip pelvic region, the two hip bones join with each other along with the sacrum to form a pelvic girdle. The pelvic girdle helps to transmit the weight of the lower limb to the axial skeleton. Now the important features on the hip bone are the number one, there are three bones: ilium, ischium, and pubis. The ilium is the outer broader bone, which has ilium is the upper flattened part of the bone, possesses the iliac crest. The flattened region of that bone is because of the iliac crest. This can be felt through the skin along its entire length. Its end is in front at the anterior superior iliac spine and behind at the posterior superior iliac spine. As we can see here, you can see this is the anterior superior iliac spine and this is the posterior superior iliac spine. This broad portion of this ilium in yellow color is the ilium, the whole ilium bone. These are the iliac crest. The anterior end is anterior superior iliac spine and the posterior end is the posterior superior iliac spine. The iliac crest extends from anterior to posterior superior iliac spine. Then their iliac tubercle lies about 2 inches 5 centimeters behind the anterior superior iliac spine. Below the anterior superior iliac spine is prominence, the anterior inferior iliac spine. Below the superior there is inferior iliac spine, anterior inferior. A similar prominence on the posterior aspect is posterior inferior iliac spine. So we have four spines on the iliac crest: anterior superior, anterior inferior, posterior superior, and posterior inferior. Above and behind the acetabulum, the ilium possesses a large notch which is called the greater sciatic notch. As we can see in the diagram, we see there is a greater sciatic notch on the posterior aspect, this above in the ilium bone, okay, on the posterior. First there is posterior superior iliac spine and then posterior inferior iliac spine. Below this there is a big notch which is called greater sciatic notch. So then iliac crest has intermediate zone, tuberculum, and the outer lip. This is the outer lip. This is the this is surface projecting laterally, okay, facing laterally, and this is the surface of the which is facing medially. Okay. The outward facing iliac crest part of the flat ilium bone has three lines. These are called gluteal lines. It is posterior, anterior, and then there is inferior gluteal line. There are three gluteal lines. So let us recall the features. There is anterior superior iliac spine, posterior superior iliac spine, anterior inferior iliac spine, and then there is posterior inferior iliac spine. Then there is greater sciatic notch. Then on the outer surface we have three lines: gluteal lines, superior, or it is called posterior, then there is anterior, and then there is inferior gluteal line. On the medial aspect we have alas of the ilium. These fossas are called alas. These the broad expanded parts of the ilium bone. Then there is ilial tuberosity, and then there is articular surface for the sacrum. This posterior medial portion is divided into, articular portion is divided into two parts. There is a rough portion superiorly which is called iliac tuberosity, and then there is a smooth part which is articular surface for the sacrum. As I have told you earlier, these two hip bones, right and left, together with sacrum forms the pelvic girdle. So this is the portion, articular surface for the sacrum. Here it combines with the sacrum to form sacroiliac joint, and above there is a roughened portion which is called iliac tuberosity. As we can see, there is posterior superior iliac spine, and then there is posterior inferior iliac spine, and these are the iliac crest, outer and inner lip of the iliac crest. These are the alas of the ilium. It makes the medial side of the hip bone. This is the lateral aspect of the hip bone. On the lateral aspect there are three lines, gluteal lines. Anterior, so first one is posterior. As it is curved, it is lying posteriorly, or we can say superior. This is anterior, and then this is inferior gluteal lines. So we finish the iliac. We will revise the iliac bone again. There is anterior, superior, the whole broadened portion is called iliac crest. There is anterior superior iliac spine. There is anterior inferior iliac spine. There are the iliac crest. On the outer surface there are posterior, anterior and inferior gluteal lines, then posterior superior iliac spine, then posterior inferior iliac spine, and then there is greater sciatic notch. And on the articular surface, medial surface, we have iliac tuberosity, and then there is articular surface for the sacrum. And extended from this posterior border of this ala of this ilium, we have this arcuate line which is coming down towards the pubis, and it ends at the pubic tubercle. This is the arcuate line. Now here in the red color is the pubic bone, and then there is ischium bone. Okay, this is the obturator foramen. The anatomical position of the pelvic girdle is like this, that posteriorly it makes joint with the sacrum. The two bones, right and left hip bones, it makes joint with the sacrum to form sacroiliac joint, and anteriorly they are connected with each other. Right and left side of the hip bone, they are connected with each other at the pubic symphysis. This is the articular facet for the opposite side of the pubic bone. It makes the pubic symphysis. Now as we go down, in blue color we can see there is a ischium bone. We have ischial spine, a projected portion is called ischial spine. Then this is the body of the ilium. This whole is the body of the ilium. The foramen is formed between pubis and the ischium, which is called obturator foramen. This one is the obturator foramen. These three bones, as you can see, this yellow color, this blue color and the red color, they combine at the acetabular cavity. There is the acetabular, is this whole cavity which articulates with the head of the femur. This is called acetabulum. Acetabulum has the lunate smooth surface. Outer there is a lunate surface, and then there is inner. There is a gap, as we can see. There is a gap left by nature on its inferior aspect, which is called acetabular notch. Then this is the acetabular margin. Okay, there is a raised margin of the acetabular cavity which is called acetabular margin. This leftover portion on the inferior aspect is called acetabular notch. Then there is lunate surface. The outer surface is smooth, which is called lunate surface, and the inner surface is a little bit trabeculated, which is the actual acetabular fossa. On the pubic aspect, we can see that there is ischial spine. This is the ischial spine, and then there is a lesser sciatic notch. On the posterior aspect, we see there is a greater sciatic notch, and in between there is ischial spine, and then comes the lesser sciatic notch. Then the roughened portion, which is called ischial tuberosity. This is the part of the hip bone over which we sit. This is the most strongest part of the hip bone. It bears our weight when we sit on a chair. Okay, this is the place of the over which we sit. This is called ischial tuberosity. There are the two rami in between the obturator foramen. Inferior ischiopubic rami, and then there is superior ischiopubic rami. In between them there is an obturator foramen. Then there is an obturator groove, as we can see, which communicates, you can see there is a groove just anterior to the obturator foramen in the pubic bone, which is called obturator groove. So, what are the features? There are three bones combined together to form a hip bone. The upper, the superior, and the larger part is formed by the ilium. The anterior part is formed by the inferior part is formed by the pubis, the red color, and then at the back we have ischium. Between pubis and the ischium there is an obturator foramen. Inferiorly there is inferior ischiopubic rami, and then superior there is superior ischiopubic rami. The three bones, they are combined at the site of acetabulum. Acetabulum is the cavity which articulates with the head of the femur to form the hip joint. It has an acetabular margin and the outer lunate surface and the inner proper acetabular fossa. The outer margin is notched on the inferior aspect to form acetabular notch. The ala of the ilium, which are called ala of the ilium, the gluteal surface, which is facing outwards, has three lines, the gluteal lines, the posterior, the anterior, and the inferior gluteal lines. The iliac crest, the upper margin, is divided into intermediate zone, the tuberculum, and the outer lip. Okay? This is the iliac crest. Then there is posterior superior iliac spine and the posterior inferior iliac spine. And then there is anterior superior iliac spine, and then there is anterior inferior iliac spine. The greater sciatic notch is separated from the lesser sciatic notch with the help of ischial spine. So this finishes our hip bone. Then comes the femur. Femur articulates with the acetabulum to form the hip joint, and below with the tibia and the patella to form the knee joint. Femur is a long bone, as you can see here. Femur is a long bone. It has the upper end and it has the lower end. In between there is a shaft. Okay, this is shaft. The upper end has a large head which articulates with the acetabulum of the hip joint to make the hip joint, and the lower end articulates with the tibia and the fibula below to form the knee joint. Okay, the upper end of the upper end of the femur has a head, a neck, and the greater and lesser trochanter. The head forms about 2/3 of the sphere and articulates with the acetabulum of the hip bone to form a hip joint. In the center of the head is a small depression called fovea capitis for the attachment of the ligament of the head. Part of the blood supply to the head of the femur from the obturator artery is conveyed along its ligament and enters the bone at the fovea. The neck which connects the head to the shaft passes downwards, backwards and laterally. Passes downward, backwards and laterally, and makes an angle of about 125 degrees, slightly less in the female with the long axis of the shaft. The size of this angle can be altered by the disease. The greater and lesser trochanter, a large eminence situated at the junction of the neck and the shaft. Connecting the two trochanter are the intertrochanteric line anteriorly, where the interfemoral ligament is attached, and the prominence intertrochanteric crest posteriorly. As you can see, there is a greater and lesser trochanter. Intertrochanteric line is anteriorly, and the intertrochanteric crest lies posteriorly. I will show you on the diagram later. On which is a quadrate tubercle. The shaft of the femur is smooth and rounded on its anterior surface, but posteriorly has a ridge, the linea aspera, to which are attached muscles and intermuscular septa. The margin of the linea aspera diverges above and below. The medial margin continues below as the medial supracondylar ridge, the abductor tubercle on the medial condyle. The lateral margin becomes continuous with the lateral supracondylar ridge. On the posterior surface of the shaft below the greater trochanter is the gluteal tuberosity for the attachment of the gluteus maximus muscle. For the attachment of the gluteus maximus muscle. This shaft becomes border towards its distal end and forms a flat triangular area on its posterior surface called the popliteal surface. The lower end of the femur has lateral and medial condyles, separated posteriorly by the intercondylar notch. The anterior surface of the condyle are joined by the The leg is the part of the lower limb between the knee joint. We see there is a patella. Patella is the largest sesamoid bone that develops within the tendon of the quadriceps femoris muscle in front of the knee joint. It is triangular and its apex lies inferiorly. The apex is connected to the tuberosity of the tibia by the ligamentum patellae. This sesamoid bones are those bones which are formed in the tendons of the large muscles. The large muscle in which the patella is, which is a sesamoid bone, is quadriceps femoris. Okay. The posterior surface articulates with the condyle of the femur. We see there on the lower end there are condyles of the femur, lateral and medial condyle. The patella is situated in an exposed position in the front of the knee joint and can easily be palpated through the skin. It is separated from the skin by an important subcutaneous bursa. The bursas are the fluid-filled sacs that reduces the friction during the movement. There is a bursa present between. There is a separated from the skin by the important subcutaneous bursa. Anteriorly, there is a bursa between skin and the patella bone, which is called subcutaneous bursa. The upper lateral medial margin give attachment to the different parts of the quadriceps femoris. The upper lateral and medial margin give attachment to the different parts of the quadriceps femoris muscle. It is prevented from being displaced laterally during the action of quadriceps muscles by the lower horizontal fibers of the vastus medialis and by the large size of the lateral condyle of the femur. Okay, now there is an interesting phenomenon. It is prevented from being displaced laterally. Laterally, there is a tendency of patella to displace, but by nature it is prevented from being displaced by the actions of quadriceps muscles by the lower horizontal fiber of the vastus. Patella is most commonly displaced on the lateral side. It is prevented by quadriceps muscles and the lower horizontal fiber of the vastus medialis and by the large fiber of the lateral condyle, large size of the lateral condyle of the femur. The large size of the lateral condyle of the femur also prevents the displacement of the patella. Now we look at the tibia. Tibia is a large weight-bearing medial bone of the leg. It articulates with the condyles of the femur and the head of the fibula above and with the talus and the distal end of the fibula below. It has an expanded upper end, a smaller lower end and a shaft. At the upper end are the lateral and medial condyles, sometimes called lateral and medial tibial plateaus, which articulates with the lateral and medial condyles of the femur and the lateral and medial menisci intervening. Separating the upper articular surface of the tibial condyles are anterior and posterior intercondylar areas. Lying between these areas is the intercondylar eminence. The lateral condyle possesses on its lateral aspect a small circular articular facet for the head of the fibula. The medial condyle has it on posterior aspect the insertion of the semimembranous muscles. The shaft of the tibia is triangular in cross section, presenting three borders and three surfaces. Its anterior medial border with the medial surface between them are subcutaneous. The anterior border is prominent and forms the skin. At the junction of the anterior border of the upper end of the tibia is a tuberosity, which receives the attachment of the ligamentum patellae. The anterior border becomes rounded below, where it becomes continuous with the medial malleolus. The lateral or interosseous border gives attachment to the interosseous membrane. We see in the leg region, along with tibia, there is a long, another very thin bone which is called fibula. In between them there is an interosseous membrane, just like in arm region and this arm region we have ulna and the radius. In between ulna and the radius we have interosseous membrane. Similarly, in the leg region we have tibia and fibula, and in between there is a interosseous membrane. The posterior surface of the shaft shows an oblique line, the soleal line. In the femur we have linea aspera, and in the tibia we have soleal line for the attachment of the soleus muscle. The lower end of the tibia is slightly expanded on the inferior aspect, shows a saddle-shaped articular surface for the talus. The lower end is prolonged downwards medially to form the medial malleolus. The lateral surface of the medial malleolus articulates with the talus. The lower end of the tibia shows a wide, rough depression on its lateral surface for the articulation of the fibula. So we repeat tibia and fibula. Here you can see this is the upper end and this is the lower end. If we start from the upper end, the anterior view, we see that there is anterior intercondylar area. This is lateral condyle, and then there is a medial condyle. This is medial intercondylar tubercle. This is a rage. This is eminence. Okay, intercondylar eminence. The rays. These are sometimes called plateau. Okay, as you can see the plateau. Okay, the medial these condyles of the tibia. This is lateral condyle and this is the medial condyle. Then there is a raised part which is called intercondylar eminence. Lateral intercondylar tubercle, medial intercondylar tubercle. Okay, then tubercle for the iliotibial tract. Here on the lateral aspect, lateral condyle, just below, there is a tubercle for the iliotibial tract. Then there is an oblique line. I told you that there is an oblique line. Then there is an tibial tuberosity on just below the anterior upper end of the tibia. There is a we can feel it over this tibial tuberosity. The tendon of the after lodging the patella bone, the tendon of the quadriceps femoris, it gets inserted on the tibial tuberosity. The oblique line joins with the tibial tuberosity. Then there is lateral surface. This is the anterior border, and then there is interosseous border. Interosseous border which give attachment to the interosseous membrane between tibia and the fibula. And then there is medial surface. Okay. This is medial surface. This is lateral surface, and this is anterior border. The lower end has the inferior articular surface. It articulates with the tarsal bones, and then there is anterior facet of the medial malleolus. The malleolus is a downward extended part of the on the medial side. This is called medial malleolus. We have the lateral malleolus on the fibula. These two bones act as a one unit because of the intervening interosseous membrane. It has fibula. On the posterior aspect of the, we have this medial epicondyle, and then there is a lateral condyle. There is an intercondylar eminence. Okay, medial intercondylar tubercle, and then there is lateral intercondylar tubercle. There is a groove for insertion of the semimembranous muscle. Then there is lateral epicondyle. We studied that there is linea aspera on the femur, but on the posterior aspect of the tibula we have soleal line. Okay, for the attachment of the big soleus muscle. We have a posterior shaft has medial surface, lateral surface, and then there is a posterior surface, and then there is anterior border, and then there is posterior border, interosseous border, and then there is a medial border. There are three borders of the shaft: anterior border, medial border, and then there is interosseous border. So how many surfaces are there? There is a posterior surface, and then there is a medial surface, and then there is lateral surface. Three surfaces and three borders on the tibia. We can see this is medial malleolus. There's inferior articular area, and then there is groove for the tibialis posterior. This is the groove for the tibialis posterior. We see that there are two joints, just like in radius and ulna. We have superior radioulnar joint, inferior radioulnar joint, and the middle radioulnar joint. Similarly, we have superior tibiofibular joint, inferior tibiofibular joint, and the middle tibiofibular joint. Okay, so now we study the fibula. The fibula is the slender lateral bone of the leg. It takes no part in the articulation of the knee joint, but below it takes no part in the transmission of the body weight, Whole of the body weight is transmitted from ground to the axial skeleton with the help of tibia. It is a thin, long bone which has no it takes no part in the transmission of body weight but provides attachment for the muscles. The fibula has an expanded upper end, a shaft, and the lower end. The upper end of the head is surmounted by a styloid process. It possesses an articular surface for the articulation with the lateral condyle of the tibia. The upper end or head is surmounted by the styloid process. We can see in the diagram we have a styloid process over here. Okay. We have on the lower end we have the lateral malleolus, but on the upper end we have a styloid process. Okay. The articular surface for the articulation with the lateral condyle of the tibia. It articulates with the tibia, so it has an articular surface for the articulation with the lateral condyle of the tibia at its upper end. The shaft of the fibula is long and slender. Typically, it has 4 borders and 4 surfaces. The medial or interosseous border give attachment to the interosseous membrane. The lower end of the fibula forms a triangular lateral malleolus which is subcutaneous. On the medial surface of the lateral malleolus is a triangular articular fissure for the articulation with the lateral aspect of the talus. Below and behind the articular fasces is a depression called malleolar fossa. The important muscle and the ligaments attached to the tibia. Then there is a malleolar fossa, articular facet for the articulation with the lateral aspect of the talus. Below and behind the articular facet is a depression called malleolar fossa. As we can see in the diagram, we see that there is a malleolar fossa over here. Okay, it articulates here with there is a fibular notch present, okay, on the tibia for the articulation with to form the inferior tibiofibular joint. Then there is lateral malleolus, and then there is a malleolar fossa. Okay, this is inferior articular surface of the tibia. We have medial malleolus on the tibia and the lateral malleolus on the fibula. Okay, now bones of the foot. We are going to name the bones of the foot. They are the tarsals, metatarsals, and then there are phalanges. There is no need to go into the details for a medical student. The detail for the foot bones, we just going to name them. This is talus, first tarsal bone is calcaneum. It's the calcaneum. Okay. Then there is talus, which has head, neck, and the sulcus tali, and then the interosseous talocalcaneal ligament for the attachment. And there is a sinus tarsi. The calcaneum has superior surface, the inferior surface, the medial surface, and the lateral surface. Medial surface possesses a large shelf-like process termed as sustentaculum tali, which assist in the support of the talus. Okay, the talus has head, neck, and the sulcus tali, and for the sulcus tarsi. Then there is a navicular bone, then there is cuboid bone, and then there are cuneiform bone. Cuneiform bones are the 3 in numbers. The 3 in number, small wedge-shaped cuneiform bones. It articulates proximally with the navicular bone and distally with the first 3 metatarsal bone. Okay, how many cuneiform bones are there? There are 3 cuneiform bones. The deep groove on the inferior aspect of the cuboid bone lodges the tendon of the peroneus longus. So let us recall the tarsal bones. There is calcaneum, there is talus, there is navicular, there is cuboid, and then there are 3 cuneiform bones. Then there are 5 metatarsal bones, and then there is, at the last, there are phalanges. Okay, as we can see in the diagram, this is calcaneum. Okay, this is talus, this is navicular, this is cuboid, and these are the cuneiform bones: medial, intermediate, and lateral. These are the 5 metatarsals, and then there are phalanges: distal and proximal and distal. This is proximal, middle, and distal. Proximal, intermediate, and distal. We can, okay, middle or intermediate is the same. So you can see here the lateral aspect of the foot. Like this is calcaneum, which makes the contact with the ground, and it makes the arches of the foot. Then talus, it forms the wrist joint, tibial joint. Okay, this is talus on the up, and then calcaneum below. Then there is cuboid bone, this is navicular, and then there are cuneiform bones. Here we can see there is lateral, intermediate, and then on the medial aspect we have medial bone. Then these are the metatarsals: 5, 4, 3, 2, and then there is 1, and then there are phalanges. Okay, now we finish here. So if we're going to revise just the names of the bones of the lower limb, we have hip bone. Hip bone is comprised of ilium, ischium, and pubis. Then there is single large long bone in the thigh, which is called femur, and then there are 2 bones, long bones, functioning together as a single unit. These are called tibia and fibula. And then there are tarsals. How many tarsals are there? There are calcaneum, talus, navicular, cuboid, and the 3 cuneiform. Then there are 5 metatarsals, and then there are phalanges. Okay, these are the names of the bones of the